Thank you very much, doctors, for joining us. It is indeed enlightening to have such a galaxy of oncologists to chat with about something that we seldom talk about here in India, and yet it is something that plagues each one of us, our families. All of us know someone or the other who has fought against cancer, and we also know someone who has won over cancer. So if we can find a template, if we can find, as they say, a formula to detect early and to fight cancer, what may that formula look like? So that's what we'll try and attempt through the course of this conversation. I want to start with Dr. Talwar. There was this WHO report which suggested that 1 out of 10 Indians are likely to get cancer, and it's only going to get worse over the next decade or two. Could you give us an overview of what the situation is vis-a-vis cancer in India compared to some of the other countries around the world? And more importantly, is there evidence to suggest that early detection helps fight cancer faster and better?
Thanks for the question. As it has been already alluded, the incidence, that is the new cases which come in India, it's about 15 lakhs. 15 lakhs per year. But this figure would be a very bourgeois figure because the detection of cases, I think it would be much more than this. So having said that, if you have 15 lakh cases in a year, that itself poses a big problem, not only to the person who's suffering, to the family, and of course to the national exchequer. So cancer screening is a very, very important tool to, sift out the areas where we can cut out these costs, because India itself is a very, very price sensitive market. And all of us know that when I, as a physician, I treat a cancer patient, I am not treating the patient, I am treating the whole family. It is a totally different ball game as far as the other diseases are concerned. So, if you take an example, say cervical cancer, you have the infection with the human papilloma virus at, say, day 1. But for it to become a proper cancer, it takes about 10 to 12 years. So if you can cut that in between, cut it short anywhere, you are doing great justice. You are not only reducing the burden of disease, but then you are treating, you are able to treat more people in a lower cost, and of course you get higher success rates. So that way, I believe cancer screening is very, very important, but for that you have to have the infrastructure.
Yeah.
You have to have the health education portals. You have to have the logistics, and of course you have to have a dedicated team who can take care of all these things. So these are the 4 pillars on which one can work on, and of course you have to have a very good data management system where you can capture the cases. And as it has been told earlier, India is not just like any small European country where
Correct.
You can, if anybody coughs, you can capture that. You have the east where you have the mountains, you have the west, you have the deserts, you have the north, you have the snow, and you have the south. So it's so diverse, so that, every area has to be individualized, and it has to be according to the nuances of that place. So definitely
Sure.
Cancer detection is very, very important.
Dr. Agrawal, you've been in this business of spreading awareness that cancer is curable, and you've been saying this across the country for the last 50 years now. There is a statistic that 40% of cancers can be tackled simply by dealing with diet, nutrition, physical activity, etc. Could you elaborate on that a bit more? Because as Indians, we are a little infamous for our diet and for lack of physical activity.
So first of all, Zaka, taking a cue from the health minister, it's not a business. So we are actually looking at service of people whom we want to cure and we want to detect early. So as you said, more than 50% of the patients who come with cancer come from 3 categories: oral cancer, cervical cancer and breast cancer. And actually, cancer is a lifestyle disease. How come lifestyle disease? Tobacco chewing is a lifestyle habit. So if you stop, chewing tobacco or smoking tobacco, you get rid of almost 30 to 40% of cancers which are associated with tobacco chewing and smoking. So it's an absolutely preventable disease. It's very easy to say, stop growing tobacco. I think the previous speakers did mention a little bit about that. But what about the farmers who are growing it, who are earning money from there? So it has got to be the vision of the Ministry of Health to see to it, and even the Agriculture Ministry, to provide alternative, means of income for people who are growing tobacco, number one. Number two, cervical cancer now, for example, over the last 20 years, actually was number one cancer. Now it has come down to number two in women. Breast cancer is number one. Why? Because the hygiene has improved over the years of women who are living in towns and small, rural areas, as was pointed out. So actually cervical cancer has come down. Now coming to third common cancer, which is breast cancer. If you look at the West, almost, 80% of cancers are detected in first or second stage. Here it's vice versa. It's the opposite. Why? So many people sitting here. How many women after the age of 40 years are going for breast mammograms? Hardly anybody. So I think there's a dearth of, as Dr. Vineet said, people are not health conscious. So, that education is very important. Availability of mammography machines is important, not only in the big towns, but also in the small, district levels and even in the rural areas. So NGOs are doing a lot of good work by, going from town to town and going to rural areas with the mammography machines. I mean, people are talking of AI.
Correct.
So, recently there was an article where they said, actually AI can pick up more than 20% cases as compared to 2 doctors who are reading the mammograms. So there is a model available. So you can implement that. You can get the AI in detecting, more number of cancers in the same mammogram by using one AI machine and the one doctor. So I think those kind of things have to come in. And oral cancers again can be detected very easily by doing an oral checkup. So, 40-50% of the cancers can either be prevented or detected early, provided the ministry has the will. And as the minister said, it's not the minister, all of us, whether we are the NGOs, whether we are at the district level. So we all have to come together to do this work.
So one of the points that Dr. Agarwal made, and I want to ask Dr. Khanna this, the grim reality is, and he quoted some of the global statistics which are inverse to what it is here in India. Globally, 30% of cancer patients are lost because of late detection, whereas in India, it is 70%. How can we change this?
It's not difficult to change at all. We just have to have the will. And I, for myself and for my organization, I can tell you that we are the only organization in Delhi who is doing free cancer screening for 4 cancers: the breast, the cervix, the prostate, and the oral cancer. You see, and we also have a bus which has a mammography machine, an X-ray machine, facilities for taking a pap smear, and an oral examination. So this bus goes from places to places. We have 2 cancer screening centers within the hospital, one in our main hospital, and then we have also set up a Dharamshila Rahat Medical Center, which is a palliative care center, but we are doing a cancer screening over there also. So cancer screening is not difficult at all. It's very easy. The problem is that we have to invite people and work so hard to get people to get cancer screening, in spite of the fact that it is free. It is totally free. And I'm very happy to tell you that practically 60 to 70 cancer cases we pick up per annum at an early stage when they're absolutely curable. Absolutely curable.
This is 60 to 70 out of how many patients?
We screen about, I would say, 100 cases per camp.
Okay.
And we do 3 camps a week. So 300
Got it.
multiplied.
It's about 1,200 camps a month. Okay, got it.
Yeah.
One of the points that was made, and I think it was mentioned earlier as well, Dr. Agarwal referred to this as well, so I want to ask Dr. Pimple this. Everybody's talking about artificial intelligence and how it can change it can transform different fields. In the field of oncology, do you see the possibility of artificial intelligence being used to detect early and thereby help prevent cancer, or at least to be able to cure it in a way that it's not fatal?
Well, so artificial intelligence has tremendous potential, no doubt about it, okay? But it has to be, developed and tested well, okay? Validation, verification of what the technology is, whether it is able to correctly identify, whether we are overdiagnosing, okay? So all these aspects have to be tested, validated in a proper research environment, and you'll have to undertake that kind of a research to prove that indeed the technology is working. And lot goes into the making of the technology also. Now we see plethora of, devices coming up with AI technology. Look, now there are WHO guidelines in terms of how these devices are to be looked into. It cannot be that anyone is approaching with an AI. AI has to be built in terms of if we take the example of mammography, AI in mammography also. Thousands and millions of images have to be collated, okay? That kind of data inputs have to go into that particular software or technology before it can be tested, and then you have to look at overdiagnosis and aspects, okay? It has to be, standardization techniques, okay? How it has to be applied, and then second, last but not the least, where the technology is going to be applied. For example, screening is different from diagnosis, okay? So the AI technology also has to be tested, whether we are going to use it into the field situation, population-based situation, or in a hospital context, okay? So lot before, it can be actually made applicable into population-based settings or adopted into a generalized setting. So lot goes into the thing.
So, Dr. Talwar, you wanted to make a point on the AI adoption in oncology.
Yeah, what Madam has said is absolutely right. I just wanted to add that wherever you have mundane tasks, where you want a high throughput analysis, like you have lakh patients and you want to see what is the hemoglobin of one patient. So you can put it through the AI, and if a guy does it, say in 100 hours, AI would be able to do in a fraction of a second.
Okay, got it.
So high throughut.
I want to get closing comments. Again, as Indians, one of the other things that we keep talking about is genetics. We know in the case of, for example, cardiovascular diseases, doctors put a premium on if you have a history of heart disease, you're likely to get heart disease. Does that necessarily apply for cancer?
Right, so I think this is a very important question. So only 5% of patients with cancer have hereditary gene, transmission from parents to, to offsprings. But cancer is a gene-based disease. Why does cancer happen? Genes get mutated or they get abnormal over a period of time. So we acquire these, because they said children don't get cancers. Why do adults and the, elderly people get it? Because of the environment, because of smoking, because of drinking. It's a lifestyle disease. So the more, you behave, misbehave with your system, the more genes get mutated. So it is a genetic disease. So therefore, all the patients, I think Harsh Mahajan is here. We're doing next generation sequencing today to diagnose cancers, which genes are abnormal. And we've gone a long way there. We've got drugs now which target those genes, and targeted therapies become the treatment for several cancers, not 1, 20, 30, 40 cancers. Cancer is not one disease. Cancer is 200 types of diseases. And there are like 20,000 types of genes which can become abnormal. So it is a genetic disease, but it is not hereditary. It is not given from the parent to the child. You acquire it during your life, and it takes several years to become 1 centimeter.
Sure.
So it takes 5 to 6 years to become 1 centimeter as a result of genes getting mutated over a period of time because of the nature, because of the environment, because of your lifestyle habits.
So the challenge is, and perhaps the solution also is, to test early and to fight surely, which is the tagline of our Sanjeevani campaign. I'll give the final word to Dr. Khanna. So when Dr. Agarwal said it's a lifestyle disease, what is the one thing that you see which is most prevalent amongst Indians, which is a bad lifestyle habit, which you reckon they should change?
I wouldn't say it is one, there are multiple of them.
Yeah, but the most.
The first most important is our tobacco and alcohol. That's
Tobacco and alcohol use, okay.
And all the oral cancers is responsible, not only oral cancer, other cancers also are related to that. Number 2 is our diet. You see, our eating style, what we are eating and what we should eat, and the things are getting from bad to worse. What was recommended was, and what has always been recommended, is what our grandparents did. Fresh vegetables, fresh fruits, whole grains, nuts, and all that. But now, pizzas and burgers, and you know what?
Fast food.
Fast
Okay.
food. And that has lot of fat, and that has lot of, you see, pesticide, I mean, not the pesticide, the, what do you call it, the...
Chemicals and...
Yeah.
All
So that is there. And then, of course, you see, our environment. There are factors in environment that which are under our control, but there's plenty of it which we have no control on those environments. And then the infections, you see, again, the infections are there, but they're treatable now, and we have vaccine. Hepatitis B is there, HPV vaccine is there. And HPV vaccine, that is why the incidence of cancer is going down so nicely.
Sure. Dr. Pimple, I'll give you the final word. Taking off from one of the points that Dr. Agarwal made, if it takes 5 to 6 years for a cancer to grow 1 centimeter, why then are we not detecting it early enough?
Well, so that's a good question, because you'll have to differentiate between what we are saying, that easily available technology, okay, that it is easy to screen, okay, but why aren't we, implementation is the thing, okay, which we have to focus upon now. It is not about the screening tool. We may be having the best of screening tool, and the screening tool could be adopted as per the resources, but the uptake, implementation strategies, going to the people and community mobilization, motivation, okay, why aren't people taking up screening? Okay, that's one aspect, okay, of implementation research which you'll have to look into. Today the uptake is not very great actually, if we say that we are screening, the actual screening is, active screening is not happening. Even among the non-communicable diseases fold, what we are doing for screening is, we are doing diabetes, we are doing hypertension, but the actual screening is not happening. Women are not coming up, okay. Now we'll have to look at overall cancer education awareness or component also. Is there any stigma attached to it? Why are not women coming up, okay?
Sure.
These are examination of the private parts. So there are so many things into context, and then of course the sustainable availability of the logistics, okay, health manpower training, sustained effort towards that, and continuation and sustenance of this particular program in implementation. And last but not the least thing, screening tool is not the only thing. Linking screen positives, okay, to appropriate diagnosis and treatment, and scaling up the infrastructure accordingly for cancer diagnosis and treatment is equally important.
All right.
Probably we are losing out on that.
10 seconds after to wrap up.
So the biggest problem in the world is that the tools which are available, the imaging, whether it is a CT scan, MRI, PET scan, does not pick up disease which is less than 7 millimeters or 5 millimeter or 1 centimeter. So therefore, all of you sitting here, Harsh Mahajan is there working for the last 30 years, and the whole world actually is working on this. Can you pick up a 2 millimeter tumor? No. No way today.
Okay.
That's why screening means 1 centimeter, and 1 centimeter means 6 years already in the body of a patient.
All right. Okay, thank you very much. Can we have a loud round of applause for Dr. Agarwal, Dr. Talwar, Dr. Khanna and Dr. Pimple. Thank you very much, doctors. Thank you very much.